Did you know that mers-cov has a mortality rate of around 35%? That's right, this virus is no joke. The WHO was notified of a human case of Middle East respiratory syndrome coronavirus, mers-cov, on 5 September by the Ministry of Health of the Kingdom of Saudi Arabia. What does this mean for public health and our safety? Hey everyone, welcome back to Health Bulletin. Today we're talking about something pretty serious. As of September, the human case of mers-cov has been reported in Saudi Arabia. This is a significant event for public health, and it raises a lot of questions about what's happening and what we need to be aware of. The case is a male from the eastern region of KSA, aged between 50-55 years, with underlying health conditions. He had no history of contact with camels and was not a healthcare worker. The follow-up of close contacts has been completed and no secondary cases have been detected. Since the beginning of the year, 5 cases including 4 deaths have been reported from KSA. Listen what WHO has to say.
Refer to MERS, Middle Eastern Respiratory Syndrome. Dr. Vankerkov may take this one.
Yeah, thanks very much. So MERS coronavirus is one of the coronaviruses that have epidemic, pandemic potential. It's only been epidemic so far. There have been about 2,600 cases that have been reported globally. Most of the cases have been reported from the Kingdom of Saudi Arabia. It's a zoonotic pathogen where dromedary camels, people with contact with infected dromedary camels can get infected, and we do see some human-to-human transmission, mainly in outbreaks in healthcare facilities. There has been a recent case that has been reported, and we just published a disease outbreak news of this individual. This is one of those viruses that has been on our radar since 2012, where the first human cases were detected from Jordan and from Saudi Arabia. We know that this virus has been circulating in dromedary camels probably since about the 80s or so. That's the most up-to-date data that we have from dromedary camels from serosurveys. So it's really critical that countries have good surveillance for MERS coronavirus. In addition to SARS-CoV-2, it's another coronavirus, and that we're working with countries mainly across the Middle East where these dromedary camels are. But it's really important that we have strong respiratory disease surveillance around the world. And again, during COVID, PCR-based systems have been significantly strengthened, and this is something that is of benefit for any of these types of pathogens, many of the types of pathogens that we're talking about today.
The notification of this case does not change WHO's overall risk assessment, which remains moderate at both the global and regional levels. We want to hear from you. What are your thoughts on this recent outbreak? Leave your comments down below. And if you're interested in learning more about infectious diseases, make sure to check out my previous videos. And subscribe to Health Bulletin for all latest update in health and science.